All right. Hello, everyone. So this video is for your Tuesday's assignment in inventory maintenance. So we are going to cover investigational drugs. So investigational drugs are a whole separate entity all in its own. So typically you're not going to find any investigational drugs in a retail pharmacy setting. You will be finding these investigational drugs in hospital settings. And the reason for that is that's where these clinical trials or these drug clinical trials are going to take place. So there's a couple of things that are involved. When we talk about investigational drugs, the important thing that we have to understand is that these drugs are not approved by the FDA. So these drugs are in the process of going through human clinical trials to get that approval to be finally approved by the FDA and brought to the market. So the important thing to understand is that if you're working in a hospital setting, you will most likely come in contact with some sort of investigational drugs or drug that is going to be stored in a pharmacy. So when we talk about where these clinical drug trials take place, these typically would take place in your big major medical facilities. So for example, here in town, UMC or Banner, University Medical Center. That is also a university hospital, is also a research hospital. So they do a lot of investigational drug trials there at UMC. So their pharmacy is going to have contact with these investigational drugs. So what has to take place prior to a investigational drug trial, human drug trial taking place at a facility? Well, couple places that you're going to look, chapter 11, page 481 to 482. We'll talk about the investigational drugs, and then in chapter 11 on page 511, we'll also talk about that as well. So each facility will have its own institutional review board, or IRB. Excuse my dogs here. So the institutional review board, in conjunction with the P&T, or the Pharmacy and Therapeutic Committee, are the two boards that will be overseeing the investigational drug trials. So you will notice that these two boards will typically meet on a monthly basis, and what they're doing is they're deciding which clinical drug trials they want to approve to be done in their facility and which ones they do not. So they have the full reign. Sorry for my dogs. They have the full reign of determining or deciding which drug manufacturers they want to partner with, or which drug researchers they want to partner with, and determining which clinical trials that they would prefer to be done within their facility. So the Institutional Review Board is the board that's responsible for not only ensuring patient safety. Now, that's kind of hard to do through investigational drug trials, but they do the best that they can. One of the things that is required for any human participants in a investigational drug trial is that these patients must sign an informed consent, and that's done before they can even participate. So the Pharmacy and Therapeutics Committee and the Institutional Review Board determine, okay, we have this patient population that we could effectively have enough participants in the clinical drug trial, and we feel that this drug has shown some very promising things in its other investigational trial parts, typically in animals, and so they're going to go ahead and decide to go forward with that. So let's see. part of your institutional review board. So those participants are going to be representatives from different parts of the pharmacy or the hospital in general. So you're going to have representatives from the departments of medicine, so probably one of the doctors. You're going to have a representative from the pharmacy, so either a clinical pharmacist or the director of pharmacy. You're going to have someone representing from nursing, so typically the director of nursing or someone up in upper management. You will also have members of hospital administration, so you can have the CEO, you can have the director of risk management, but anyone in an administrator position, and then you're going to have basically a community member. So this could be anyone from the community. It doesn't have to be, a medical personnel. In fact, they typically don't like it to be someone that has any of that type of background, just because they need additional body to kind of bring different views to the situation. So again, when we have patients who are interested in participating in these investigational drug trials, each patient participant must fill out an informed consent, which is a document that clearly, in layperson terms, will pan out, or my brain just took a moment here, perfectly lay out in layman's term everything about the study itself, what the risks are, what are the potential benefits, any reimbursement that they may receive, any monetary reimbursement that they may receive, if any, and then the follow-up responsibilities and procedures of what may take place if there's an adverse event to the investigational drug itself. So they must read the entire informed consent. They must assign it, and that's got to be on record before these patients can start that. So when it comes to storage, okay, so receiving and storage. So when a hospital facility decides that they are going to participate in a clinical drug trial, these drugs are then shipped to the pharmacy department, and that's something that as technicians we have to be very cautious with and receiving these properly. We receive them in the very similar way that we receive our normal drug orders. So these are going to come in totes, they are going to come in boxes, they are going to come in with their own separate invoices. But the interesting thing about these investigational drugs is that they are not going to have names on them. There's not any drug name that is assigned to these investigational drugs, and that is because they have not been approved by the FDA. So when we are receiving, okay, we want to make sure that we're, again, reconciling our invoice to what we actually received in the tote. It's the same concept. We want to make sure that we're storing these in the proper areas. Okay, now the biggest thing here is that because investigational drugs are not approved by the FDA, they cannot be stored with prescription medications at all, period. There has to be a completely separate area and location that these are stored on the shelf, in a completely different part of the pharmacy, and that includes a refrigerator. So let's say that the pharmacy decides that they are participating in a drug trial, that the investigational drug must be refrigerated. They have to have a completely separate refrigerator in a completely separate area of the pharmacy that is deemed specific for investigational drugs. They cannot throw it in the same refrigerator as that they store the vaccines and insulins and anything like that. The reason for that is because we, have not been given the green light by the FDA to go ahead and dispense these medications to the public. So we face huge errors if we dispense an investigational drug to a different patient in the hospital by mistake. And so one of the ways to avoid that is to ensure that we are storing all of our investigational drugs in a completely separate location within the pharmacy. Ordering, if you are tasked with ordering of drugs, so let's say you've moved into a purchaser's role, which most of the time in every facility the purchaser is going to be a pharmacy technician. The investigational drugs do require special ordering. So you're not going to be able to just jump onto your wholesaler's website and order these investigational drugs. This ordering is going to be direct between the manufacturer who is developing the drug and the pharmacy department. So if I was a purchaser, I would contact either through their website or through the contact person at the manufacturer and request an order, put that order in, and so it's a direct communication between the manufacturer and the pharmacy. There's no wholesaler involved or anything like that. Handling and record keeping. So if we were in our pharmacy classroom now, which I know we're all chomping at the bit to get back, I know I am, I have some mock, investigational drugs that we do. We do an receiving order lab for this, and we keep them in a completely locked cabinet away from the rest of our mock drugs. And the reason for that is to show you the separation of where we would keep prescription drugs versus where we would keep the investigational drugs. So we have those, and when you would receive an order, you're going to receive the order, receive the invoice. I'm going to put the invoices and stuff up on inside of this day's assignment folder so you can take a look and see what those look like. And then we have a logbook that we actually keep in the cabinet with those. And when we're receiving the order, we're going to not only put the invoice in with the logbook, but we have to log in those medications. So when you are receiving investigational drugs, you're going to log those into the logbook that you have received them, the name on it, which is usually a number and letter sequence, again, because it's not an actual drug name, the quantity on that, and then you're going to, on the flip side, when you're dispensing that to whatever unit they are doing the investigational drug trials, you're going to check that out patient specific. So 1 bottle is going to a patient, or 10 tablets, or whatever it is. That's how you're going to subtract it out of the logbook, but it's going to be specific to each patient. So the important thing to understand is that in most of these, the drug is not labeled with a name or strength. So because of that, as technicians, we must label them with the drug study code, which is going to be assigned to that specifically by the Institutional Review Board, the lot number, and the expiration date. So that's what we're putting on the labels of these investigational drugs as we're dispensing them to the patient participants. So again, the drug study code will go on the label, the lot number, and the expiration date. It still has to have a label. The label is going to look very different than the label of a prescription medication that we're dispensing to a patient on one of our units because they're, an inpatient. These patients are coming in to participate into the trial because it's a medication coming out of pharmacy. Even if it's investigational, we still have to have a label on it. Well, because these are investigational drugs, they don't have drug names, we have to put some information on that label. So that is going to be the drug study code, the lot number, which you're going to retrieve from the invoice, and then the expiration date. Okay. We are also in charge of returning. So let's say at the end of a clinical drug trial, these manufacturers are going to expect that we're returning any unused investigational drugs back to them. A couple things. One, because we don't know everything about that drug yet. It hasn't been approved, which part of that process includes proper disposal of. So we as the pharmacy don't want to take that responsibility on how to dispose of these investigational drugs. And also, we don't want to just have a bunch of investigational drugs laying around where it could potentially lead to a mix-up between, prescription medications that we're dispensing to patients versus it being an investigational drug that should not be. Again, investigational drugs are completely separate entity. You won't find these in a retail setting. You're going to see these in a hospital setting, but it's important that you know the components of how the investigational drug trial is going to take place. If you have any questions, be sure to email me, and I hope you have a good day.